What is going on, Team Acne? Welcome to a very special video. I'm super excited about this. This is something I've actually been wanting to do for a long time. I have my friend Dr. Tagari here, who is an absolute expert on skin, and I wanted to sit down with him because he's going to walk us through the exact treatments that are the best for each type of acne scarring and discoloration that you have. This is something that I think is really good to come from an actual expert, so I'm really pumped to have you on here. Thank you, first of all. I really appreciate it.
Appreciate you having me.
And before we actually get into that, what exactly do you do here, and how long have you been in the skin industry?
I've been in the industry for decades. I've been the medical director of Avalon Laser for over 10 years. We're a medical spa. We do all kinds of skin treatments. We treat acne scars. We do all kinds of laser treatments for hair removal, anti-aging. You know, we treat the full gamut of cosmetic issues that people come with, Botox, fillers, and so on. And really, depending on the age group, it really determines the type of things and concerns that we encounter on a day-to-day basis. So I was working with different cosmetic companies before that for a few years. As Avalon Laser, we've been able to put some of the best practitioners in the industry under one roof, which is one of the reasons why we've been growing so well.
Yeah, we actually have a little bit of history. Was it 2, 3? How many years ago was that?
Yeah, I think about 3 years ago.
You did 3 different Dermapen treatments on me.
Yeah.
So that was pretty cool, and that's one of the reasons that we kind of connected. And definitely, I feel like you have a lot of information to give people. So without further ado, let's actually dive into this.
Looking forward to it.
I would say probably the most common acne scars that a lot of people are dealing with are boxcar, ice pick scars, rolling scars. So talk me through what you would do with each of those type of scars.
It's very important first to make sure that clients identify the type of scars that they have. If they're going to talk to their practitioner, it's very important that they use the correct nomenclature and the right language to describe the scars, because the treatment for each of the scars is very different and the approach is going to vary. Most people have a combination of different types of scars. It's very, very unusual in our experience that somebody has all of one type of scar and none of the others. So we find that just to keep things consistent in our industry, that we break it into the 4 generally main types that people will encounter for the majority of cases. Ice pick scars is one that you've described, and the way that these are typically presented are very thin, narrow, ice pick looking scars which go very deep. That's category number 1. Most of the time, people are going to come with rolling type scars, which are depressed scars which occur after inflammation has kind of eroded the tissue underneath. So that once the healing has occurred, the skin tends to depress into the area of the skin matrix that was destroyed by the inflammation. And that's general category number 2. The third category generally are pigmented scars. This oftentimes occurs in people who have any type of skin color to them, and as a result of the inflammation, say from acne, that inflammation is going to leave behind the pigmentation as kind of a byproduct or residue, and that stays into the skin long after the inflammation or the acne is resolved. And the fourth type that we see oftentimes are keloid scars, which are usually raised above the flat surface of the skin. And these separate entities, they all have different approaches for best results.
Okay. Yeah, so I think that's a good way to break them up. For me, I don't even know if you remember how long ago when we first did meet.
Yeah.
But we went with Dermapen, and so basically, why would we do Dermapen for my type of scar? What kind of scars was I dealing with that we,
Most of what you had, from what I remember, were the second category that we talked about, the depressed scars. And this is really the majority of people's acne scars or any type of scars that involve inflammation. And typically speaking, with depressed scars, you generally want to make sure that they are deep enough for Dermapen to address, but not so deep that something else might need to be done. In your case, Dermapen alone or microneedling was really what was the majority of what was needed. Some people have depressed scars that are so deep, the inflammation went so far down that the depression actually went to a level that Dermapen alone would not be able to solve, or would require so many sessions that it wouldn't be cost effective. In those situations, we might actually sometimes put filler. Dermal fillers, similar to what we would do for smile lines or even lip augmentation. Different types of fillers can be used that will help elevate the skin so that the depression or the concavity is not so deep. Once that is lifted, and that has to be done by a licensed and experienced practitioner, but once that's done, which we do here quite frequently, you find that you get an immediate improvement in the decrease in the depth of depression. Then after that, it's a relatively simple job to do microneedling to smooth it over.
Okay, so that makes sense. like basically the severity of how deep the depressions are changes how you would first approach it. And you mentioned ice pick scars, and I think you were mentioning that ice pick scars have a little bit of a different approach to them.
Correct.
Okay.
Microneedling is really not going to do as good of a job with those. We find that because they tend to be very narrow and very deep, what you generally want to do is you want to almost cauterize that concavity and just erode it to where the skin just closes. Typically, we use a method that we call TCA cross. It involves a trichloroacetic acid chemical commonly used in chemical peels, for example, but at a slightly higher concentration. The goal is to use a specialized dropper, very, very narrow specialized dropper that will get into that cavity but not touch the surrounding skin. The purpose of that is to kind of cauterize that scar and make it flat. Any depression that's left afterwards, we can microneedle or laser on top of it much more easily. But those types of scars require that very specific approach.
Okay, that's awesome, because I think a lot of people who have ice pick scars really want to know, like, what's the specific thing for them, because it is a lot different.
Yeah.
And so you say that's a type of chemical peel. Is there another type of scar that a chemical peel would address as well?
Yes.
Okay.
I'm glad you brought that up. Many times we have a lot of dead skin that sits on the surface. And you can think of this as sort of as armor plating to protect the skin from the environment. If you did a cross-section of the skin of the face, you're going to find that there's many, many more layers of dead skin that sit there compared to an area that's covered, like, say, the back. The reason for this is because the skin requires a little bit more protection from the environment, the elements, the sun, the wind, and so on. Because the skin on the face generally tends to be thicker and there are many more layers of dead skin, that dead skin has several effects when it comes to scars. Number one, it's going to augment the appearance of any concave scars. So by getting rid of the dead skin and exfoliating it, you immediately improve the appearance even of depressed scars. Number two, it actually traps pigment. Skin works from bottom to top. So any pigment that's trapped tends to come to the surface, and that pigmentation can be easily removed by exfoliating that dead skin. So one thing that we can do very, very quickly is either do a microdermabrasion, which is basically a fancy form of exfoliation using a diamond tip that rapidly rotates, or we can use specialized chemical peels, depending on the skin type, that will immediately exfoliate the skin and help make any pigmented scars less visible and any depressed scars less prominent. We do that all the time.
Okay. And I like how you keep saying, like, different types of skin have different types of, treatments to them. So when it comes to hyperpigmentation, dark spots, it usually occurs more in people who have darker skin.
Correct.
What would you go with someone who had hyperpigmentation?
So I'm glad you asked that, because darker skinned people are more prone to having melanin in the skin that can oftentimes leave pigmentation behind in response to inflammation. Chemical peels can either remove the dead skin on the surface, which is great because it oftentimes will pull that pigment out, but they can also bleach pigmentation that's left behind. And different types of peels, if the expert knows how to handle them and knows the different types of peels and is expert on how to use them, different types of peels can be used on different types of skin and give you the best results. Not all peels are appropriate for different types of skin. Darker type skin, you have to be a little bit more careful to make sure that you don't overdo it, because ultimately, if inflammation is causing the pigmentation, inflammation from a peel can also produce pigmentation. So a lot of times, an inexperienced practitioner might potentially use the wrong peel for the wrong type of skin and make the problem worse.
I think it's good that you're talking about this, because I think a lot of times when it comes to acne scarring or just like any sort of skin treatment, it's kind of like a one size fits all. And people kind of just like, do this, it's good for everybody.
Sure.
And I do have a lot of people who comment and they're like, hey, I'm a darker skin tone, and like, is this even good for me? And so I think it's cool to kind of address that. And also I think it's important for people who are listening to, find a doctor who actually is able to be like, hey, you're gonna need a different thing than someone with lighter skin.
Right.
And so speaking of that too, someone like me who has lighter skin is less prone to hyperpigmentation and dark spots. More likely will have erythema, like red spots. How would you approach that?
I'm actually glad you brought that up as well. Not only are the different types of peels necessary to be used for the different types of skin, but different types of lasers need to be used for different types of pigmentation. Red pigmentation tends to respond better to photofacial IPL, which is kind of the granddaddy of laser treatments. It's been around for a long time. There's different manufacturers that make different quality lasers, similar to car manufacturers making, really good quality cars or, average cars. But really, really, really red types of pigmentation tend to respond, generally speaking, with IPL types of lasers. Brown and darker types of pigmentation typically respond to other types of lasers better. Now, the variety of lasers is huge, and it's sort of a misconception that just any laser will get the job done. A lighter skinned person such as you, we have a lot more options that we can choose from depending on how quickly we want the pigmentation to be resolved. If we want to do skin tightening alongside, because sometimes older adults will come that have been dealing with acne scars, they've been putting it off for a long time, and they might even get some benefit from getting rid of some of that loose skin that can simultaneously, coexist. But if somebody comes in their darker skin, the options with terms of lasers and pigmentation really dictate the type of laser you're going to use. It's not a one-size-fits-all. And one of the things that gets people in trouble that we actually have to fix is when they've gone somewhere and a well-meaning practitioner has treated their skin, treated their acne, and either hasn't had the acne under control, causing more flare, causing more inflammation, causing more pigmentation and more scars, or they chose the wrong laser for their skin type, and that caused complications as well. An experienced practitioner should look at you, determine your skin type, determine the type of scars, look at your goals in terms of your lifestyle, how much time you have to afford, how many sessions it might take. If you have all the downtime in the world that you can afford, it's going to dictate the treatment that we use versus somebody who has to go to work every day, maybe doesn't want to show the world that they're getting a treatment. They want to keep it private, which is totally fine. But these are all considerations that we employ at Avalon Laser when it comes to deciding what to choose for the person.
So I actually really like the thing, you mentioned something that made me come up with another question, because I had one last question, but
Sure.
Now there's another one. When people are thinking about their acne scars, a lot of times they'll have acne scarring, they'll have these spots, hyperpigmentation or erythema, but they're still breaking out with active acne at the moment.
Yes.
And a lot of people will say, when is the right time to start treating my scars, or should I wait until it's completely clear? Do you have anything?
That is probably one of the most important points, and I'm really, really glad you brought it up. I really appreciate that. And I get calls from practitioners elsewhere around the country, and they say, well, I did what you said, but this happened. And usually I ask them, did you get the acne under control first? Right? You cannot fix acne scars without controlling the problem at the source first. If you have acne, there's a reason for it. It might be diet, and I really love the fact that you're, meatless. I am too. I think it's fantastic. I'm very proud of you. I think it's awesome. Keep it going. But sometimes people's diet contribute. But generally speaking, if skin has not really been controlled, the oils, the skin hygiene has not been employed, and somebody's prone to getting acne breakouts, the things that you do to treat the acne scars can oftentimes temporarily clog those pores. And if the acne is not under control, doing the treatment for the acne scars can cause more acne breakouts. And then it's self-defeating. You haven't fixed the problem if you've caused more of that same problem, right? So we tell people, as an experienced practitioner should know this, get the acne under control. There's many, many, many ways to do it. Once the acne is under control, then we can address the scars, and then we don't have to worry about the acne coming back and causing more problems.
And because we're on this little vein here, some people are coming off of accutane, and they're saying, I got off of accutane this week. Am I allowed to go get treatments right now? Is there a certain amount of time I should wait before I start treatments?
Yeah, that's also a great question. I've never been a fan of accutane. I think technologies and formulations have become so advanced that I've had people come off of accutane and follow our directions. They don't have to go through the whole birth control process and the contracts and so on, and they avoid the side effects of accutane. And I've been very, very successful with getting people off of accutane and onto less, what's the word I should use? Less aggressive treatments, things that are a little bit more gentle and more nourishing and healthy for the skin. So if you are on accutane, because the residual effects of accutane can linger, any type of laser treatment, you really have to wait at least a couple months. It used to be 6 months, and then they found with more recent studies that it got shortened down to 2. A lot of times people will also be on antibiotics. And many of the antibiotics that people used back in the old days, and I think it's really unnecessary to use something that is going to mess up with your entire gut bacteria, which is important for your digestion and so on. Many of those same antibiotics can also increase your the reaction of lasers on your skin. So they cause photosensitivity. So if you're on certain types of anti-acne antibiotics, you also have to delay a lot of laser treatments for that reason, which is another reason why I'm not a fan of antibiotics as well. If a practitioner is very experienced and knows how to minimize harm while maximizing benefit, they're going to be able to give you great results without causing more complications.
Okay, so it may be wise just to give yourself a few months regardless of what you're treating your acne with before you start going with the treatments for
Absolutely.
Scars.
Yeah.
Okay, and then the last one, and I know this is like a less common type of scar that people deal with, but I think it's important that we address them all because some people do have keloid scars. How would you address keloid scars?
Keloid scars can come from a number of causes, and sometimes somebody may have a keloid scar because they may have an incision or a cut, and perhaps it was not stitched properly, or perhaps the wound was contaminated, perhaps there's a lot of inflammation. If the skin is not aligned perfectly after trauma, you're going to have the body fill in the empty spaces with connective tissue. And that connective tissue on the surface appears as a scar. If it's not somebody who's prone to keloid scarring, a lot of times, if the scar is big enough, you can cut out or excise that scar, reapproximate the skin using a lot more advanced surgical technique, and make the scar a lot less visible. And that's an option for people. Sometimes we do punch biopsies and we actually cut out the scars with specialized tools that can do that, and then put a stitch in there. It heals beautifully. However, there are people, for example, some African Americans that we've treated, they're prone to getting keloid scars from any trauma. In those instances, trying to cut out a keloid scar doesn't make a lot of sense, because if you cut into the skin, you're going to cause another keloid scar, right? In those instances, the time-honored treatment is really just to inject the scar with topical or injectable steroids, right? And those steroids over time will shrink the keloid scars. Sometimes 1 or 2 treatments is enough to shrink it down, but unfortunately for some clients, it does require to be done at intervals for years. And luckily, those are very few and far between. We haven't seen a lot of those in practice, but if any of your people out there have got keloid scars, it is imperative that they be treated in the hands of somebody who is experienced in the procedure.
This is so good. I feel like I have like 20 other questions. I feel like we're vibing really good. This is a good video. I feel like there's a lot of information in this.
Yeah, I appreciate it.
I appreciate you being on here.
Thank you.
And yeah, like I said, I feel like I can do 100 more questions. So if you guys who are listening have any questions that maybe you want me to address in the future, let us know in the comments below. But yeah, thank you so much for coming on here and doing this. This is really, really cool, and I think it's going to help a lot of people.
We appreciate you, Brian. Thanks for what you do.
Yeah. Do you have any Instagram or social media that people will follow you on?
We do. Avalon Laser is our Instagram handle. Please follow us. We love people's feedback and comments. It allows us to also get their photos and stuff sent to us as well. They can see a lot of the specials that we offer at different seasons. Depending on the time of year, people definitely have different desires for specials, and we try to accommodate that. We also try to bring the latest information on technologies through our Instagram, and it's disseminated. We're on Facebook as well at Avalon Laser. So please follow us. We'd love to see you guys there.
Yeah, thanks a lot. If you guys are coming to San Diego at any point, if you live here, absolutely check this place out. My friend Dr. Tirgari is kick butt at all this stuff. So I hope you guys enjoyed this video. If you did, give it a big old thumbs up. Let me know what you thought in the comments below, and subscribe if you're not subscribed already. Remember, you are not alone, you are beautiful, and you're part of Team Acne. I'll see you guys in the next video.